Um, Thanks for joining me. We're supposed to have Dr. Rashid Buttar on today, but he might not be able to make it. So I'm just going to go ahead and start talking about something else that I've been planning to talk about, which is my website, mygotodoc.com, and some of the new things that we're doing there. So I'm just going to share my screen, and if he does join, then I'll introduce him and add him. So here I'm just showing you my GoToDoc website, which is my website. I mean, it's essentially the same as my other website, which is drsyedhaider.com, but it kind of talks a little bit less about COVID and focuses more on these other services that I wanted to discuss and just give you some background and details about why I have decided to offer them. So up here you can see COVID-19 is still listed, but when you click it, it takes you to drsyedhaider.com. Otherwise, the back end is basically the same between these two websites. So let's just go back to, okay, so what I wanted to talk about was the emergency antibiotics backup meds that we're offering and kind of the reason that I decided to offer these. So we were trying to address these problems. First of all, supply chains. So the medications in this country are primarily imported from overseas, and most of them from China and India, especially antibiotics. 97% of antibiotics come from China. And with our just-in-time supply chains, if those break down, as we've seen happen lately with baby formula and previously with other things that weren't really super critical, like toilet paper, but if supply chains did break down around antibiotics, that could be a serious issue. And you know, looking back over the last couple of years, we've seen what happened, first of all, with COVID, which disrupted supply chains, and now with China's zero COVID policy. If they happen to shut down a city that is manufacturing most of the antibiotics for us, that could cause a serious issue if it lasts more than a week or two, because we just don't have the backup supplies in this country. So if ships stop sailing the seas and stop arriving on our shores, we would run out of critical medications, not just antibiotics, a lot of other medications as well within a week or two. The other thing is bioterror. So we see what's happened in the last couple of years with the pandemic, and how people felt so terrorized by a virus that had a 0.1% death rate. There are other bioweapons out there with much higher death rates, 30% plus death rates. So those include anthrax, plague, tularemia. And the medications that are included in this antibiotic med kit, there's 6 of them, cover basically everything you can imagine treating at home with an antibiotic, plus these bioweapons, anthrax, plague, and tularemia. And then this is also useful for people who might be traveling out of state or overseas, just having some, antibiotics in case of travel. So what you usually get from most doctors, they might give you Cipro or a Z-Pack, but this includes a whole lot of other things. So you don't have to trust a pharmacy in a foreign country, or even when you're traveling out of states, sometimes kind of difficult to get a prescription from your own doctor if they're not technically allowed to prescribe for you when you're out of their state, if unless they're licensed in the state that you're in. And then for people who are off grid, camping or whatever. So the solutions that we came up with were the emergency antibiotic kit. It covers things like pneumonia, sinusitis, strep throat, all kinds of things, including the bioweapons that I talked about. Basically, anything you can imagine treating with an antibiotic at home can probably be treated with these antibiotics. And so there's 6 of them. Includes augmentin, which is amoxicillin, clavulanic acid, doxycycline, ciprofloxacin, azithromycin, metronidazole, and if I didn't say azithromycin already, I think I did, Keflex, ceflexin. So these things treat like animal bites, human bites, and skin infections, like I said before, sinusitis, sore throats, ear infections, pneumonia, bronchitis, you name it. And then the other thing that I would recommend people having on hand would be backup medications. So it says 1 month here, but I've actually decided to do 6 weeks of a backup medical supply for people who have chronic medications like hypertension, diabetes, heart disease. And we saw with Hurricane Katrina, people who, if they had meds that were needed to be refilled, and then Hurricane Katrina hit, they suddenly weren't able to refill their medications. Pharmacies were closed. They couldn't reach their doctor. hospitals were overwhelmed, and a lot of these people in New Orleans couldn't even get out of the city to go to another, hospital or doctor or pharmacy somewhere else. For a lot of different reasons. The roads were shut down. There was debris lying everywhere. It was hard to travel, and some people just didn't have the money to travel. So, that's kind of the thought behind these latest med kits. And I am still doing COVID-19 pandemic stuff, and I just wanted to mention that real quick. What we've seen, and I'll see if I can share this other screen. Let me just pull it up. We're seeing with the pandemic that in the last 4 weeks or so, the the numbers are rising. So here, I'm just pulling it up on Google. Um, this is for Puerto Rico. You see, it's like quite a big spike, but I'll just show the entire United States. Some states have spiked tremendously, but on average across the U.S., this was the Omicron spike here. And then we hit kind of like a low point around the end of March. And ever since then, the last couple of weeks, you can see the curve. I don't know if you can see it, but it's very slowly rising. And so the 7-day average was hit a low of about, let's see, 28, 29, 28, 28, April 4th. Okay, so a little less than 2 weeks ago. So 8 days ago, about a week ago. And since then, our 7-day average has gone from 28 up into the low 30s, up into the low 40s, up into the low 50s, and now it's and then low 60s and low 70s, and now it's in the mid 80s. So 7-day average cases are 85,629 right now, and the curve is actually rising at a increasingly fast rate. So with each passing day, the increase is accelerating. Those are new cases. Deaths, you can also see suddenly spiked up. Um, let's see, around the 7-day average spiked up on May 4th. Since then, it's dropped back down, and we would expect, I don't know, this might have been an outlier or something, but we would expect deaths to take a couple of weeks to start rising if they will rise with the BA2 variant that we're seeing now. And then hospitalizations, you can see, have also trended up, although it looks like ICU cases are close to where they were a couple of weeks ago. They haven't really changed, but hospitalizations have definitely started to rise here. So anyway, what this highlights is that we we are seeing the next wave right now of the pandemic. And what's more concerning is the interview that I had with Geert Vanden Bossche that you can find on this channel. In the last day or two, I spoke to him, and that was really concerning because he was warning that after this variant, we may see another one that specifically targets vaccinated patients. Um, and so, for those reasons, the fact that this variant is rising, um, and a new future variant may affect vaccinated patients more than other patients. But regardless of who gets most affected in terms of hospitalizations and deaths, I still worry about everyone, including people who are naturally immune, like myself and my family members. Even the naturally immune who never got vaccinated are at risk of long COVID. This thing shouldn't be taken lightly. So, um, let's see. Let me see if there's any questions here. Don't seem to be populating for me. Um, if we have any questions, I'll talk about it. But it doesn't look like Dr. Butcher is going to be coming today. Hopefully, we can reschedule him. I don't see any questions right now. Yes, super alien, the super fan. What's your question? Yeah, Denise says New Jersey has the highest number today since January 29th. Yeah. I mean, if you pull up other states, you can see some crazy numbers. Some some states have really spiked quite a bit. See if I can pull it up. So I'll just pull up New Jersey here. So cases have risen more than the rest of the country, according to this. Wow, 2.3 million total cases with 33,000 deaths recorded. I mean, you can take that with a grain of salt. I mean, they probably, well, who knows whether they were all COVID or not. And the US at this point is at 82.2 million that we've tested at least. So Super Alien, you said you had a question, but I didn't see the question. Oh, wait, here we. Okay, it looks like the chat is populating now for me. What do you think of pregnenolone? So I haven't looked into pregnenolone at all for, I'm assuming you're talking about COVID. I honestly, I hesitate to give hormones. I do have some training in functional medicine, but I've always shied away from doing hormone therapy just because from a more traditional perspective, going back to, you know, like Chinese medicine and herbal medicine, those kind of traditions, and Ayurvedic medicine that I have a bit of a background in. I'm not like an expert or anything, but in some of these more traditional systems, hormones are considered really powerful, right? Like very tiny amounts have a really profound effect on your body. So I usually try to help people balance their hormones without actually giving them hormones, and so I would be a little bit worried about giving pregnenolone for COVID-19 or for brain fog, just because there's so many other options. I mean, if you try everything else, that's less likely to cause knock-on effects. That's the issue with hormones, that you're talking about a very delicate system in the body, and everything's interconnected with hormones and with a lot of other things, but especially with hormones. If you know add more of one hormone, it has a lot of other effects on many other hormones in the body, and it's actually, the complexity is so much that we can't predict what's going to happen in a certain person, and then you may not see the ultimate consequences of that treatment for years. So so personally speaking, I hesitate to recommend hormones for things, especially when they can be treated by something else. I mean, if you're kind of at your wit's end and you've tried everything else and there's nothing, and it's a serious problem, then certainly, go for it. And some people need hormones. I understand. I mean, obviously, like levothyroxine, or some people don't have a thyroid. They need to take the extra thyroid hormones. So that's a different story. Um, some people absolutely have to have them. But when you're talking about going and getting a hormone test and finding, oh, I'm low in testosterone, or I'm low in, in progesterone or something, or estrogen, and maybe I'll just boost it and start feeling better. And in those cases, I would hesitate, especially when you're talking about, a complex system like the human being, where you have something like brain fog, which has multiple inputs leading to that. And even if you find a bunch of things off in your body, including hormone levels, they may be secondary, and they may not be the primary root cause, or there may be 15, 20, 30 different contributing factors to brain fog, to the final outcome, the final symptom. And if you just fix most of them, the brain fog will go away. So this is kind of the way the human body works, and the way functional medicine physicians understand complex systems is that, and especially in the human body, it's usually not just one thing. It's usually multiple factors. And if you fix enough of those factors, you don't have to fix all of them to go back to a state of health. You just have to fix, a majority of them sometimes. So anyway, that's my 2 cents on pregnenolone. Um, Again, if you had tried everything else and you were still stuck with the brain fog, then you may really have, a deficiency of pregnenolone, and need to replace it. Um, New Jersey has the highest number. Yeah. I'm in South Carolina. Yep. I have worked in South Carolina before as a hospitalist. It's a beautiful place. Among vaccinated folks, yeah, it seems to be rising, definitely. So it's the BA2 subvariant right now, Stephen. Some people consider it, or think it should be its own variant, but at this point, it's considered a subvariant of Omicron. Yeah, Jax. I tend to think Geert Vanden Bossche is right, but at the same time, he's the only person speaking at his level about these topics. So there's really, his understanding of these things is far beyond my own and most physicians out there. So we wouldn't even know how to, you know, argue with him or be able to like evaluate whether there's some kind of opposing opinion or some other possibilities out there. I mean, I just don't know enough about vaccinology and immunology. um, I can barely follow what he's telling me. That's about it. I can just like barely keep up with what he's explaining. And when you're that far out of your depth, I mean, there could be a valid opposing viewpoint, but you just wouldn't know it. You just don't know what you don't know. And so that's why it's so vital that we have robust debate. I wish other people at his level with his background in vaccinology and immunology would come forward and either agree with him or debate him or give their point of view. I mean, a couple of people, a couple of that of people who specialize in maybe like virology and are prominent virologists have come out and disagreed with him, but they don't have his background in immunology and vaccinology and vaccine development, and so he's been able to easily debunk their efforts to debunk him. So yeah, I'm definitely concerned with his predictions. RD Luzao says, my question is regarding immunity. So after all the boosters, can folks, let me just stop sharing the screen. After all the boosters, can folks still get sick and as bad as someone that doesn't? Yeah. Yeah. I mean, the boosters, all they seem to be doing is, if anything right now, I mean, it depends on who you ask. I mean, some people think that the boosters have no effect except negative, that they increase your risk of catching COVID. I think Gert's position is that currently people are experiencing a benefit for severity. They're not like less prone to catch it, but they may be less prone to severe disease, possibly. And it may just be the current variant that the boosters have created. But anyway, it seems that the best case scenario, they give you a few weeks of possibly less severe illness if you catch it. It's possible, or they might prevent you from catching it for a few weeks. Honestly, I don't know. I wouldn't take a booster, but they can still get sick after like 4 or 6 weeks. They're actually more prone to catching the virus, whichever variant's going around. So the boosters don't seem to be really adding anything beneficial for most people, and I would certainly I would not destroy my immune system by even taking the first shot. And um, whether or not once you've started vaccinations, whether you need to continue, I probably wouldn't do that either. Not when we have effective therapies, like ivermectin and hydroxychloroquine, fluvoxamine, those kind of things. You can either take ivermectin on an ongoing basis, or you can just hold on to those things in case you get sick. If a variant came around in the next couple of months, like Vanden Bossche is warning, that was specifically targeting and was specifically more severe for vaccinated patients, then I would definitely recommend that they take ongoing prophylaxis. Yeah, I got MCAS for a month, then hormone dysregulation for 2 weeks. Yeah, MCAS is so common after COVID. I mean, some people just think long COVID is MCAS, and in a lot of cases, it does appear to be, or at least a component of long COVID is that. And hormone dysregulation is also unsurprising, quite common. Super Alien says I've tried like 100 supplements so far. So if you're talking about traumatic brain injury, or you saw a documentary about traumatic brain injury, and they recommended pregnenolone with vitamin D. So if you have traumatic brain injury, I mean, it's possible. It depends on what's causing your symptoms, right? If you have long COVID or if you have traumatic brain injury causing brain fog. I wouldn't just rely on supplements, though. Trying different supplements. I would try like deep, drastic lifestyle change. And if that doesn't work, if we're talking about COVID, then obviously there's COVID treatments. And the latest I've heard about for long COVID would be ozonated oils, um, pure PUR03. You can search for that online. They have a website, sells different strengths of ozonated oils that apparently help with long COVID. You can apply them topically and then they get absorbed into your body. And then for long COVID, and I don't know much about this, but a mesenchymal stem cell transfusion, 1 30-minute transfusion may be helpful according to some people. But if you're just talking about brain fog in general, that's unrelated to COVID, or even if it is related to COVID, another approach is, kind of the comprehensive functional medicine approach of people like, who is that? Is the author of The End of Alzheimer's, Dale Bredesen. So he has what's invariably called the Bredesen Protocol or the Recode Protocol. And so there's a bunch of clinics all over the country where people practice his approach. And his approach is basically that functional medicine idea of, okay, you have a bunch of different problems that are contributing. So, a bunch of different things, like 30, 40, 50, maybe different things that if you optimize enough of them, the brain fog will go away. I mean, he's had tremendous success with brain fog, which is, and people with early Alzheimer's. Basically, he's even been able to reverse early Alzheimer's by optimizing. And sometimes you do have to optimize hormones. So you try everything else. You try fixing everything. You do a bunch of tests. You figure out whether you have chronic infections and whether you have heavy metal toxicity and whether you have low vitamin levels, and you do everything. You rule out everything and you fix everything, and you're still left with hormones out of whack. Then yes, you do have to sometimes fix hormones. But yeah, brain fog it's serious, and it should be taken seriously because if it's not addressed, it's definitely a risk factor for Alzheimer's. And especially if you're, relatively young, middle aged, actually at any age, you should take brain fog seriously because Alzheimer's is basically something that kills people eventually. And that's the first sign of Alzheimer's is this just not feeling that you're as sharp as you used to be, and you may not even you know people may not even be able to notice with any testing. It's just like something that you feel yourself, that you're not as sharp or you can't think of words and stuff. Just Vicky is saying, wondering about renewable script for the IV med and hydroxy med. Yeah, I think I do usually give refills actually on the prescriptions. um Generally, I mean, maybe farther back I didn't used to, but I think nowadays I give everyone generally, I think, a refill for most things, just in case you need another one. Um, anyway, I'll have to double check. I mean, I've gotten so like automatic for me when I'm writing these prescriptions. But I think for the acute prescriptions, I'm pretty sure, and I don't think there's a difference between the acute and the preventive prescriptions when I write them. I write them the same way or for the same amount. Um, if you were wrong, somebody from Big Pharma would have come out with facts to debunk him. And yeah, this is what's concerning about everyone who's speaking out, that there's really no one debunking anyone. And I mean, I was just thinking about this the other day, that you can, if you're talking about climate change or like the moon landing, you can find so much stuff on both sides of the debate. There's people who say, okay, we never landed on the moon. And there's other people who say, I mean, obviously we landed on the moon. There's people who say that, climate change isn't a real threat. And there's other people who say, obviously it's a big threat. But you can go down the rabbit hole on both sides of those debates and find just like reams and reams of data and information, and just like people have spent their whole lives, debunking the other side. Um, and for somebody who's not an expert in the climate or in the moon landing even, or who's not like a scientist who doesn't understand like how physics works and how like they have all these arguments based on the photographs from the moon landing. If you're not like an expert in optics, and you're reading the websites of people who say that we never landed on the moon, I mean, you can't argue with them. You're like, wow, this is quite convincing, like maybe we didn't land on the moon. And then you go and read, the opposing side's arguments, and you're like, oh, wow, they just debunked everything I just read. But you can go back and forth and have a really hard time figuring it out. Like, where's the truth? It's so difficult. But for this, for COVID-19, there's none of that. It's all one-sided. All the arguments and all the red flags are on our side, and no one's responding to them in any way at all, in any way, shape, or form. So I think that is extremely concerning. I mean, it points to the fact that they really can't come up with anything convincing. I mean, you can't. The fact checkers really don't have anything good to put up there that even a reasonable person would agree with or understand. I mean, let alone you don't even need to have. I mean, what I'm trying to say is usually you have to be deeply versed in a field in order to be able to detect that somebody is like BSing you, right? Whereas here, I guess there's nothing, right? They have nothing. They don't have a leg to stand on, which does kind of suggest, that it suggests that there's really nothing that there is no argument that they can make. There's even anyone who's not even well versed in science would be able to see that if they tried to argue back against the people who are saying that vaccines are a problem, all this stuff about the pandemic, raising all these red flags, if they tried to argue back, anyone with any amount of understanding of how the world works would be able to see through it. How many variants can we expect with Omicron? I don't know. you know um, if it changes enough, and eventually it'll be a new variant. And some people think that BA2 should be its own variant instead of subvariant, and maybe it's just political. Why it's called BA2 instead of the next letter in the Greek alphabet. I don't know. I mean, it seems that at some point, around the time when we started shifting everything coverage to the Ukraine, somebody at somewhere in the government decided that, hey, we need to shift focus away from COVID, and maybe part of that decision was, hey, we're not going to call it a new variant. We'll just call it a subvariant. So, is it plausible that the latest stronger variants find it easier to reinfect a vaccinated person? Because the virus needs a host. Is it plausible that the latest stronger variants find it easier to reinfect a vaccinated person with a spike protein spreading through their body? So the latest variants are more infectious, and one reason that they're more infectious is because vaccinated people have antibodies to the original spike protein, and the variants that have spread because they had resistance to those antibodies. The antibodies didn't bind to them. So that's the reason that they can more easily affect people who have been vaccinated. The fact that spike protein is in somebody's body and possibly causing inflammation, and disease, that certainly also lowers immunity. So, yes, I think that's kind of like what you're getting at here. That just spike protein itself is a toxin, and when you have chronic inflammation in your body, you have lower immunity. Um, Nuna says, just like Geert Vanden Bossche said would happen, he's saying it will get worse in the future due to mass vaccination. Yep. So Super Alien says, first dose and last. Why, when my brain fog kicks in, something moves on the top of my head? So weird. Yeah. I mean, people have all sorts of weird sensations with vaccine injuries and long COVID too. I mean, if you haven't tried the ozonated oils, I would give those a try. Pure 03 has. Oh, I think you did ask about those, right? So yeah, they yeah. So you start off with the lowest, the least strong ones or the least potent ones, and gradually work your way up to the more potent ones. And yeah, I do prescribe hydroxychloroquine routinely. Um, Jaxel says he also said what vaccine protects us from severe illness but allows mild to moderate illness? None. These shots are baloney. Yeah, yeah, they're not vaccines, right? I mean, it's so hard. I mean, it's like we've been programmed to call them vaccines. Just can't stop doing it. Sometimes I try to call them injections, mRNA injections or therapies, but they're not vaccines. Um, EK says, how comfortable are you diagnosing and treating MCAS after COVID? I mean, this is like the bread and butter of what we do is treat MCAS after COVID, so long COVID. And it's not really that complicated because the treatment is, I mean, it's basically a protocol, right? Which is why it's easy to do online is we're just following, for most people, we're following a set protocol. You try ivermectin, then you try steroid, and then you try this and try that and try that, and eventually you might want to try Mravroc, and if that doesn't work, then um, maybe you want to go and get, go to the next step and maybe try some kind of mesenchymal stem cell infusion. So far, none of my patients have gone for a stem cell infusion, but that's kind of something I've thought about in the back of my mind since hearing about it, that if all else fails, then maybe try that. Um, but the initial stages are, even before you start medications, you go on a low diet and don't exercise too much, don't do any cardiovascular exercise, maybe try fasting, and then maybe try some supplements, and then you start adding antihistamines, over-the-counter antihistamines, and of course, and a bunch of other things. The quercetin is a supplement that you would have added probably earlier, but and then prescription drugs, aspirin, blood thinners, and then ivermectin, prednisone, maybe fluvoxamine. So, I mean, it's a pretty standard approach. It's a standardized approach. And the reason it is because so far we don't really have great ways of predicting based on symptoms what's going to help, other than like, okay, you have MCAS, obviously antihistamines are kind of like the first thing that comes to mind: Claritin, Zyrtec, and famotidine, um, hitting your histamine receptors, blocking them, and quercetin also has antihistamine effects. So, and then if it's really like obviously, allergy type of MCAS type of symptoms, and it's not always the symptoms that you think of. Like, for example, migraines can be caused by histamine. It's not something people usually think of as an allergic reaction or an allergy type of symptom. Um, but a lot of the headaches that people have and brain fog can be caused by too much histamine in your body, so can be related to MCAS. But you can also add, and this is all in the FLCCC protocol. So there's, it's a kind of a branching protocol. It can go in different directions. You can go down the MCAS route where you're adding Singulair and or Montelukast and other um, advanced approaches to histamine as well. Um, let's see. Do I treat long COVID? Yeah. So Blues Lover is asking if I treat long COVID for patients in South Carolina, and is it the Patterson or the Corey protocol or my own? So it's kind of a conglomeration. I mean, it is very similar to the Dr. Corey's protocol at the FLCCC. I tend to use a higher dose and a longer dose of ivermectin in the beginning, and um, than what's listed for the FLCCC. But the rest of the protocol is very similar to the FLCCC protocol. I use the same prednisone protocol that they're recommending, and fluvoxamine I use just like they recommend. Low dose naltrexone, Vascepa, I think they recommend now. So I think I probably got that from them even. Um, I've added pravastatin, which is more from Patterson's protocol. Or no. I think FLCCC also has pravastatin. They may write atorvastatin on the FLCCC website, but I prefer Patterson's pravastatin, which is a lower strength statin. So it's kind of a mixture of the two protocols, and um, but it's very similar. I think the main difference is my ivermectin dose is higher and it goes on for longer. I'll usually recommend zero point 0.2 milligrams per kilogram daily for a week, and then if that's not working, increase to 0.4 milligrams per kilogram daily for a week. And if that's not really helping, then we'll taper it off slowly and kind of keep people on 0.2 milligrams per kilogram twice a week. Generally speaking, most people until their symptoms are gone. Even if they think that it's not really helping, I think it's beneficial. One other thing actually that I'm just now thinking of doing is actually one thing I've just done is prescribe Paxlovid for the first patient with long COVID, and we'll see how the results come back. I actually recommended he try tollovid first, which is an herbal kind of 3CL protease inhibitor product that's available. It's very expensive. I'm actually developing my own under the My Go-To Stack brand. So the first product that we're coming out with is going to be a vitamin product similar to Zelenko's product, but with the addition of bromelain, which is required for absorbing quercetin. And then probably the second product is going to be this, maybe second or third product is going to be the 3CL protease inhibitor, which is actually going to be better than what tollovid has made. I mean, theirs isn't actually going to be, ours is going to be actually a lot stronger and probably a lot cheaper too. I mean, I think they're just price gouging. It's just more than it should cost. But the patient didn't want to try tollovid. They wanted to go straight to paxlovid. And so I was like, okay. And the reason I tried it, was that there have been a few scattered reports, even in the mainstream media, saying that people with long COVID suddenly get way better or their symptoms resolve. One researcher actually tried it on themselves and their symptoms resolved of long COVID. And so the idea, Paxlovid or any 3CL protease inhibitor, whether it's herbal or whether it's Paxlovid, the way it works is by inhibiting the enzyme that the virus needs to replicate. And so, if it's working for long COVID, I can think of two possibilities. One is that it's a placebo effect, which you can't write off, and the other is that they actually have a chronic viral infection. So most long COVID we've been assuming is not an infection, um, and but if they did have like a sequestered infection somewhere in their body, it would be very difficult to detect and to prove that. And and so that might be why we don't know that that's what's causing long COVID. It's a possibility that the virus is turned into a chronic infection, and it's not just spike protein the way that Patterson thinks. It's not just S1 subunit of spike protein, in your monocytes, or it is that, but it's coming from a chronic infection. That's why it persists, right? The chronic infection, and there's just persistence of spike protein, and then it drifts out into your monocytes, and that's just kind of a secondary issue. But why are so that's the reasoning behind Paxlovid and other 3CL protease inhibitors like tollovid and the product that we're developing. And so and this is, there's actually a cat model, of a chronic coronavirus infection in the gut. I forget what it's called, but one of my patients actually turned me on to this months ago, maybe even a year ago at this point. And so basically there's a particular coronavirus that sets up a chronic infection in the gut of cats. And so the same thing could be happening with COVID-19. People with long COVID, maybe all of them have a chronic infection. We just don't realize it. So hopefully we'll have studies using 3CL protease inhibitors or Paxlovid, and that also might be part of the reason that ivermectin helps with long COVID. It may be more than just the anti-inflammatory effects. It may also be the antiviral effects. And if that's the case, you would also expect hydroxychloroquine to help, and other antivirals like 3CL protease inhibitors. So that is something kind of a lot. Another new thing that I've kind of tacked on is like, okay, if nothing else works, maybe we try a 3CL protease inhibitor. Sooner or later, at some point, maybe we add that and give that a shot. Like I said, I hesitate to use Paxlovid just because it has ritonavir and it's got serious side effect risk. But at the same time, the herbal 3CL protease inhibitors, they probably have similar side effects. I mean, maybe they have similar side effects. Just because something is natural doesn't always mean it's safer. But yeah, I mean, if you look up the side effects of Paxlovid, you should also look up the side effects of it's two compounds. One is an HIV drug, ritonavir, and that's been around a lot longer than the other one, which is the newer compound for COVID. But the older one has a lot more side effects data. So when you look at the side effects, you'll be like, oh, it kind of makes you think twice. And so that, things like that, where there's a lot of significant side effects possible, I kind of put lower down on my list of things to try. I am licensed in so many states. I don't remember if I'm licensed in South Carolina. It should be on my website though. When you register, you should be able to see whether South Carolina is one of the options. Um, Tennessee and New Hampshire have ivermectin over the counter now. That's amazing. That's so amazing. That's great. I mean, it should be over the counter everywhere in the world. It's safer than literally every over the counter medication I can think of. It's safer than Tylenol, aspirin, ibuprofen, Benadryl, Claritin, Zyrtec. Just anything. Everything. Anything and everything. I can't think of any other medication that's safer than ivermectin. I mean, I've used it more than most people in the world at this point on more patients, and um, even the things that people warn about almost never happen, right? Like one of the warnings is that it might worsen asthma. I think one out of tens of thousands who were prescribed it might have said something about their asthma feeling a little bit off. Not a big deal. And then, can raise liver enzymes, also pretty rare and not really concerning. It's not liver failure. It's just a kind of a side effect. Um, Temperature of the moon, space radiation, not likely. Yeah. Um, Jaxel, the vaccinated's innate immune system is impaired. Yeah, vaccine acquired immunodeficiency. What do you think about Evusheld, the preventative monoclonal antibodies for the immunocompromised? So actually, I don't know anything about this product. I don't know what is Evusheld. Oh, Tixagevimab. Investigational. Yeah, I don't have an opinion because I don't know anything about it. Um, so it's I'm not going to try to pronounce it. I don't think anyone knows how to pronounce it. It's a combination of two human monoclonal antibodies targeted against the surface spike protein of SARS-CoV-2 used to prevent COVID-19. It's being developed by British-Swedish multinational pharmaceutical biotech company AstraZeneca. It's co-packaged and given as two separate consecutive intramuscular injections. One injection per monoclonal antibody given in immediate succession. So okay, to evaluate the antibody's potential as monoclonal antibody-based prophylaxis, the PROVENT clinical trial enrolled 5,000 high-risk but not yet infected individuals and monitored them for 15 months. The trial reported that those receiving the cocktail showed a 77% reduction in symptomatic COVID-19 and that there were no severe cases or deaths. AstraZeneca also found that the antibody cocktail neutralizes recent emergent SARS-CoV-2 viral variants, including Delta and Omicron. So that's good news that they did check it against Omicron. Without looking at the actual data, it's hard to say, just because pharmaceutical companies can misrepresent their data, and this is one of the big problems I have with all data is that they don't actually give you access to their raw data. They just, they show you what they want to show you. They write up a paper, and that's the data that you have access to, what they want you to see. So you have to take everything that a pharmaceutical company says with a grain of salt, unfortunately. This sounds very promising. In contrast to pre-exposure prophylaxis, the Storm Chaser study of already exposed people did not meet its primary endpoint, which was prevention of symptomatic COVID. So it seems that it may be beneficial. I don't know if it's actually available yet, though. Yeah, I'm not sure if it's actually available. Let me see. After the CDC changed the definition of vaccination, taking a vitamin now qualifies. Yeah. Yeah, phenyltia, I've heard about this too. I couldn't really find much data on phenyl-T. Is there any difference in who gets long COVID with people that have been injected or not injected? So we just don't have good information on this. We don't have a lot of good information on long COVID. There haven't been enough studies done, so I can't really say whether vaccines help it or hurt it, and I wouldn't trust data that said that getting vaccinated prevents long COVID. I mean, they were trying to say that in the beginning about vaccines, and I would not believe that. Even if it did, you're just messing with your immune system in a way that you don't want to. Denise says, I wonder about paxlovid for long COVID. Yeah, I wondered about paxlovid for long COVID. I have tollovid and tried last night for the first time, but it seems to have triggered my MCAS overnight. Yeah, so MCAS is a tricky thing. Tollovid, from what I know, has the herb in it, like an herbal extract, maybe, or like not an herbal extract, or yeah, an herbal extract. I think what they're using is probably kind of a purified, strengthened version of of the whole herb, plus lecithin. So, I mean, it's possible that the dose was just too high, and maybe you can like crack it open and repackage it at a smaller dose and try again. And maybe it's the lecithin. I mean, it's a possibility, or it's probably the herb, probably not the lecithin, but it could be either one, triggering allergic type of symptoms. The best thing you could try would be to try to maybe pull apart the capsule and make it into smaller quantities and gradually try to increase it. And at the same time, treat the MCAS. Use antihistamines. Use try to decrease the amount of histamine you're getting from your diet and from any other source. But maybe you may just not tolerate it. Yeah, Jaxel says that's why I end up taking nothing. I read the side effects. Yeah, and sometimes the best treatment is just time. You just be patient, wait long enough, and things just wear off. And I hope that's the case with long COVID for a lot of people. Maybe it's just like you just got to put up with it for a year or two, and then it goes away. At the same time, I'm worried that the inflammation could set up people for chronic disease, and so that's one of the reasons that I think that it should be diagnosed and treated, just because you have chronic inflammation from it. So it does seem to get better for a lot of people over time, but other people, you would want to at least monitor it and make sure that your inflammation is going down. How long will ivermectin stay good? So I haven't seen specific like studies on ivermectin, but the U.S. government, like I said at the beginning of this, I think has tested, or maybe I didn't say this, but along the lines of keeping antibiotics for a long period of time. If you get a prescription of antibiotics from us or from your own doctor, how long will they last? The U.S. government did some studies on antibiotics, and ivermectin has some antibiotic effects. But anyway, they did studies on common antibiotics 20, 30 years ago and followed them, kept them for 20 years and found that they only decreased potency by 10%. So they still had 90% efficacy after 20 years. And in general, ivermectin, I would assume, given it's like a capsule usually or a tablet, it should last for a really long time, especially if you put it in a food tight air storage or airtight food storage container in the fridge. Um, I wouldn't worry actually about how long it stays good, but we don't have specific data on ivermectin. We just know that in general, dry medications probably have a really, really long shelf life, especially if they're not, in a hot place with direct sunlight, and especially if you put them in the fridge and put them in an airtight container. What's the longest a person can stay on 0.4 milligram per kilogram ivermectin daily? And do people who go on that medication usually take it twice a day or the whole dose at once? Usually it doesn't matter whether you take it once or twice a day. It has such a long duration of action that it doesn't kick in really quickly, and it stays around your body for a long time. So medications that are like that, it doesn't really matter if you take. I mean, you could take it probably even once a week at a really high dose, and it would have a similar effect. So, but people, yeah, they can stay on it for. I mean, I've had people stay on it for like 2 months. I don't do that very often, but this one lady, I mean, the lady who did that, she had mold toxicity, and it was the only thing she'd ever tried that got rid of all of her mold toxicity symptoms, which really it blew my mind. I mean, I didn't think that was possible, and while she was still exposed to mold in her house. she had continuing mold exposure and severe mold toxicity, and her symptoms went away. And the only thing that really helped her was high dose ivermectin daily, and so she stayed on it for 2 months. And so, everyone's different. Some people are a little bit more sensitive, and um, one really rare thing I've seen, like literally like one in more than 1,000 people, so it's very rare, was that somebody's had been on it for a few weeks, and they had this side effect of like feeling dizzy, and when they stopped it, the side effect didn't go away immediately because it stays in your body for a really long time. I mean, it stays in your body for months, and it very slowly leaches out of your body. So if you are sensitive to it and you develop a side effect, it is possible the side effect will persist for a while before the drug levels drop in your own body. Um, but generally speaking, you would be able to tell whether that was the case for you pretty much right away. I mean, if you took zero point 0.4 milligrams for a few days and you didn't have any side effects, it's pretty unlikely that you would develop them over time. But it is possible because the levels um, will continue to increase for some time as you're taking it daily. Um, Have you seen someone fully recover from brain fog first dose post vaccine? So this is basically the same question as like, have you seen people fully recover from vaccine injuries or from long COVID? And I've seen people recover from both, but not including brain fog, I think. But it's like most of the time, like 99% of the time, people will get like 80, 90, 95% better, and then they'll just stop following up. So I don't ever see them until the very end. And then I don't know, did they fully recover and just never told me, or did they just like kind of, they were like, oh, this is good enough. I don't want to bother with this anymore, and 95% better is enough for me. So it's kind of hard to find people who tell you that they've gotten 100% better. um, Most people you'll find are like 90, 95% better. um, but I can't specifically think of somebody who specifically had brain fog after one dose of vaccine and improved back to 100% normal. um, Gromwell root, yeah, that's what's in tollovid. And what I'm doing is, I'm adding the 3CL protease inhibitor from Gromwell, and I'm actually um, it's chiconin, which is kind of the active ingredient that has those effects, or one of them at least. And I'm adding like extra chiconin, which tollovid has not done. And then I'm also taking Scutellaria bicalensis. I don't know how to pronounce this. It's Chinese skullcap, and adding an extract of that with bicaline and bicalin. And those are actually, from what I've seen, stronger 3CL protease inhibitors than Gromwell even. So I'm going to combine both of them into a supplement, a 3CL protease inhibitor supplement, and hopefully try that on some patients with acute and long COVID. Yeah, where is Dr. Butter? I don't know. I guess he was. I think he was in clinic, and something must have happened to. So hopefully we'll be able to talk to him some other time. We'll try to reschedule with him soon. Um, all right. Yeah. um, yeah. I hope things look up in Australia. Super alien. Much love, and yeah. I've been so shocked at what's happened in Australia and Canada. Um, I just never expected it, and those countries. What's happened there. It's just like horrifying. So I hope things aren't too bad in Australia for you. Um, yeah, sulforaphane and broccoli is quite helpful. You can, the best thing is if you can get something from, real food, and you can actually juice broccoli. I mean, it doesn't seem like it would be juiceable, but it is. And you might, if you find that sulforaphane helps, maybe juicing broccoli would help even more. Um, so recommendations for prevention recovery from influenza A. Um, Impacting the family ages 5 to 40. Yeah, so I it's possible that some of the same things that work for coronavirus also work for prevention and treatment of influenza. So yeah, I think that there's some evidence showing that ivermectin helps prevent and treat possibly influenza. And so some people there's actually a long influenza or a long flu similar to long COVID, and I had never actually known about it until I learned about long COVID. It's apparently less common than long COVID, but there is some people do develop like a post-infectious syndrome with the flu as well. And we suspect that all post-infectious syndromes or ongoing infectious syndromes like chronic infectious like Lyme disease, chronic Lyme, chronic mold toxicity, long COVID, and possibly other things like CMV and other post-infectious syndromes from viruses like chronic fatigue syndrome and stuff. We suspect that they all have similarities, and if they all have similarities in their pathology and pathogenesis, then they may have similar treatments may work for them. So I do try these things. The like long COVID treatments, I try them for people with Lyme disease, mold toxicity, and I would consider trying them with people who have persistent symptoms after the flu or after CMV or after Epstein-Barr virus as well. Yeah, so the Gromwell Shikonen skull cap product is going to be released at mygotostack.com. Don't try to buy it right now because there's one thing up there, but really the website's not ready yet. Um, we are working on it. It should the vitamin product that we're releasing should be ready in the next few days, hopefully, and then I don't know, maybe in the next few weeks we'll be ready with there's going to be a second herbal supplement combo, which is going to have curcumin and black seed and some other things in it, which will go well with the vitamin product. And for people who, it's basically, things taken from the FLCCC protocols and my own protocols that I'm using for prevention and treatment of acute and long COVID, and just um, trying to make supplements that are kind of specific for what I've been doing that I couldn't find anywhere else. So and then the Gromwell Shikonen product should be on the same website, hopefully in the next few weeks. Yeah, daily probiotic. So you can't really say that, you can't give like a blanket recommendation for most things. So some people have like bacterial overgrowth and dysbiosis in their intestines, SIBO, small intestinal bacterial overgrowth. And for some people with those kind of issues, which are actually quite common in the population, probiotics may interfere with getting better. Um, and in other cases they help. So probiotics, it's like something that you can consider trying and seeing, and a prebiotic as well. But if it worsens your symptoms, then yeah, if you have symptoms and it worsens them, or if it gives you like stomach upset or something, then obviously it's not working for you. I mean, you can try to push through it for a while. Maybe it's like you need some time to get over, get used to it. But really, probiotics just pass through your system, right? And they do seem to be beneficial, even though they don't stick around for very long. Like they stick around for a week or two, and then they pass through. They don't stay, right? So it's not like you're able. Typically speaking, you can't get them to like take up residence in your gut if they're not already there. Um, so, but they still have beneficial effects on their way through. But the best way to change your gut flora, the bacterial species in your gut, and to shift it in a different direction or a healthier direction, is to change what you eat, because what grows in there depends on what you feed it, right? So you're not only feeding yourself, you're feeding the healthy bacteria in your gut and everywhere in your body with the stuff that you choose to eat. And um, traditional cultures that I've looked at had much more varied diets than we do. I mean, some traditional cultures used to eat like hundreds of different plants during a year, and we eat maybe half a dozen, maybe a dozen max. I mean, there just aren't that many plants available in a U.S. grocery store. So whatever there is available, I would recommend people who are really interested in their gut health, they should not just go to like a regular grocery store. They should go to like every ethnic grocery store you can find and get all these like vegetables and fruits that you've never heard of, and learn how to make them, and kind of cycle through them. Just and eat with the seasons. Don't eat out of season. Try to eat the root vegetables in the winter, and the fresh greens in the summer, and also in the winter maybe some fermented stuff that's been stored. But yeah, so I think that's probably the place to start, is just like start with your diet first, and then yeah, a probiotic is something to consider. Certainly it's been recommended for long COVID, and it's recommended all the time by functional medicine practitioners who are trying to help people correct gut problems. And um, once you get your diet in a good place, it's something worth trying. So really everything I would consider it experimental on any specific person. You have to run an experiment on yourself, which means, I mean, the best way to run an experiment is to change one variable. And so you would keep everything else the same and add a probiotic, see how you feel after a couple of weeks, and then decide, is this adding something to my health or not? Because you'll see patients with like 100 different supplements that they've been taking, and they can't really tell you if they're benefiting from any of them, right? So the goal is not just to like, you know, think that you're helping yourself, but really just creating expensive urine. You want to actually be benefiting yourself, and so you should, I mean, sometimes it's difficult, but you should try to see some benefit with what you add in your health. And the only way to really tell is to change that one variable at a time, and then wait a while. You got to be patient with this. So you change that one, you add the probiotic, and then you wait for a few weeks, at least 2 weeks, to see. And then at the same time, you got to track your health really closely. So you got to like have this experimental scientific mindset that, okay, I'm going to track my health across these 5, 6, 7, 10 variables, and I'm going to graph it out, and I'm going to see, like, does anything change? Because you just can't tell unless you do it like that. I watched your interview with Geert Vanden Bossche. Frightening. What do you tell people who are vaccinated, given his prediction that the vax may be more susceptible to a more virulent strain? Um, yeah, so I think I did kind of answer this earlier. So people who are vaccinated, so the approach I think would be, even though that strain that he's warning about may not be spreading or prevalent in the community right now, um, once it does start spreading, and it may already be there, right? So, but once it does start spreading, there's going to be a lag time, during which we're not going to know about it, and you may be exposed to it if you're vaccinated. So, it might be smart, at this point in time, for people who are vaccinated to start taking ivermectin twice a week now. Don't wait until the word actually gets out that that variant is spreading and vaccinated people are ending up in the hospital, and the world's ending. Maybe don't wait for then, and certainly don't wait to get the ivermectin until then. So this is kind of along the same lines as getting just generic antibiotics into your house beforehand in case of a supply chain breakdown. I mean, the same thing can happen with ivermectin. I mean, we don't know. I just, so far we've had access to ivermectin in this country, maybe not from your local pharmacy, but from mail order pharmacies. But I highly recommend, don't wait until the world's ending to try to get something that you need. Get it beforehand. And so with vaccinated patients, the safest approach to take, if you believe Geert Vanden Bossche, which unfortunately I do. I mean, it sounds crazy, and that's what I'm telling, actually, my people in my own family who got vaccinated against my advice. I'm telling them, you need to get the medicines now, and either you take the ivermectin twice a week, but at least you have everything ready to go on day one as soon as you feel symptoms. So these are your two options: you take ivermectin twice a week and have all the medications on hand in case you start to feel sick, and then you have to assume that you have COVID when you start to feel sick and start treating it right away. And the other thing you have to realize is that it may not feel like COVID to you, right? So it may not be a runny nose. So, like, different variants have affected people. I mean, I just spoke to somebody today who had a confirmed case of COVID, and her symptoms were all like neurological. She had no runny nose, cough, sore throat. All she had was like dizziness and nausea, and there were stomach symptoms too, which you see with COVID. So some people, she initially didn't think it was COVID. She was like, I'm stressed out or whatever, and she's feeling nausea, and then she started vomiting, and she was having a headache, and she was dizzy, and she didn't think COVID. So you got to just think COVID. If your health takes a turn for the worst, think COVID, treat COVID, and that is safer than letting it go and then trying to treat it on day 3, 4, or 5. You really got to try to treat it on that first day as soon as your health takes a turn for the worst. And it might just be something like a subtle thing, like a tickle in your throat, or you feel under the weather. And it's better to pull the trigger and treat it than not. So for people who have been vaccinated, um, at least get the medicines into your medicine cabinet. And I'm talking about ivermectin, fluvoxamine, hydroxychloroquine, budesonide, um, and that's kind of like the core that you need, along with all the vitamins. And then seriously consider taking ivermectin twice a week and still keeping enough on hand to treat a full-blown infection if it happens. So at least 5 to 7 days at all times, like of full strength ivermectin. So if you start to run low on ivermectin, you have to get a refill. Thank you. Just Vicky says, thank you. Got a multi-probiotic that needs refrigeration after taking antibiotics. Make sure there aren't any Dominion voting machines. That was one of the tricks that was used in the US. My husband and I have stayed healthy with mild use of ivermectin we got from you and good nutrition, supplementation, and sleep and exercise. It's good to hear, Sovereign Magic. Just Vicky, yeah, that makes total sense. I try to chart everything I take and write down how I feel. Three Amigos says prebiotics for good flora prevention and probiotics for gut flora repair. Is that true? Yeah, so I mean, essentially, prebiotics are kind of like what the bacteria in your gut need, as food, right? So that's what a prebiotic is, and then the probiotics, and sometimes you take both together, right? Because the probiotics need prebiotics to grow, and yeah, so yeah, so gut flora repair. Like I said before, probiotics typically don't stay in your gut, so they don't actually fix the mix of bacteria in your gut long term. If you continue taking them, they'll stay in your gut. They'll be there. Um, but if you really want to fix the flora in your gut, the only way to do it is to change what you eat. There are no two ways about it. So if you change what you eat, the bacteria in your gut change almost immediately. So you're choosing what grows in your own gut, unless something gains a foothold, like a really invasive species basically gains a foothold. Sometimes it's difficult to get rid of without taking either an herbal antibiotic or an actual antibiotic like rifaximin. Sometimes you have to kill off the bad and then work on getting the good back, and it can take 9-10 months to rebuild healthy levels. And I mean, if you're really interested in this, you got to do testing, right? So there's advanced testing available now that you're not going to get from your GI doctor, but you can get it from places like Doctors Data and Genova. They have comprehensive stool studies that'll tell you the health of your gut, basically, and whether you have good bacteria or bad. Is there a preferred way to take ivermectin? Yeah. So, wow, I feel like I'm blanking here. I think I recommend taking a food. I've been doing this so long, I just have these things that I copy and paste. I just send it to everyone. Um, but it's in the directions that I send all the time. Yeah. For proper absorption, ivermectin is taken with food or just after eating. Yeah. Yeah. That is important. So the pharmacy might tell you to take it on an empty stomach with water, and the reason they do that is because usually ivermectin is meant to kill stuff in your gut, right? And to treat something that's in the lumen of the gut, so it's inside the gut, and you actually don't want it to be absorbed, kind of like rifaximin. So rifaximin is used for SIBO, and it doesn't get systemically absorbed. It just stays in your gut and it kills the bad bacteria in your gut. And so ivermectin is usually used like that, and the pharmacy assumes that we're using it like that, but we're not. So we actually want it to be absorbed, but in order for it to be absorbed, you have to have it with food. Do statins play a role in downregulating CCR5? Not that I know of. From Bruce Patterson's various presentations on the topic. So my understanding from him was that statins are he's usually prescribing them as like a anti-inflammatory, basically. So for their anti-inflammatory effects on the vasculature, um, and oftentimes when the SD40L is raised. The only thing that I'm aware of that's going to downregulate CCR5 is Maraviroc. We really have no other CCR5 inhibitor in the arsenal currently available, commercially available for people. Yeah, and there are no herbal supplements that do what Maraviroc does. I've looked for it. If anyone finds one, I would be interested in making that available to people. But yeah, I don't know of any other CCR. I mean, there are other CCR5 inhibitors. They're just not available, to purchase. And I'm not aware of any herbal ones that do that. I would assume there must be something herbal somewhere, whether we know of it or not. But I haven't been able to find one. So ivermectin, yeah, I mean it's going to have some antibiotic effects. Ivermectin has weak antibiotic effects, so that will change your gut flora. I'm not aware. I'm not sure whether it changes it in a good way or a bad way. Um, I would be interested in seeing any, data or studies on it. Should unvax take ivermectin twice per week as well? Yeah, I don't. I'm not as concerned about unvaxxed patients at this point in the pandemic with Omicron going around. I would just keep treatment, COVID treatment on hand to start taking it on day one of an infection. And the reason is to prevent long COVID. So to diminish your chances of long COVID, you want to kill the virus. You know, this possibility that long COVID is related to chronic viral infection is concerning to me. But regardless of what causes long COVID, it's so common, and I think it's so underdiagnosed and such a serious issue that it's something that you don't want. So you're trying to prevent long COVID primarily. Um, and if you're really concerned about it, yeah, I guess you could take ivermectin twice a week. But at this point, I don't think it's necessary to do that. If you're going to promise yourself that you'll treat it, starting on day 1 or 2 with, ivermectin and hydroxychloroquine and other medications. If you can promise yourself and be sure that you'll do that, then I don't think it's as important to take ivermectin twice a week. If you're not sure that you can do that or you don't think you will, then you might lean towards ivermectin twice a week. Um, yeah, ivermectin with a fatty meal. Yeah, so fecal transplants are like a last ditch kind of thing. And I mean, there's some really promising information around fecal transplants. But like, how do you get it? Where do you go to get it? Do you do it yourself? The concern with fecal transplants is like, what if the person I'm getting the transplant from has some problems that that may be undiagnosed that we're unaware of, right? So that's the only concern. Otherwise, there have been like miraculous improvements in some people's health when they got a fecal transplant done from somebody who was healthy. And you can go to centers that do this. There's one in Australia, there's one in England. I don't know if anyone's doing it in the US at this point. Maybe there is somebody, but I'm not aware of a center in the US that's doing it for anything other than C. diff. So it's commonly used for C. diff in the US. And aside from that, I don't think it's been approved or being used in the United States for anything else. But in Australia and the UK, I think that there are some good centers that are using it for other chronic issues. Um, it just feels kind of gross to me, right? So otherwise, yeah, I mean, if nothing else works, if it's one of those things where I would try everything else and then I would want to be 100% sure that the person I'm getting it from is really healthy, and I would probably do some bunch of testing on them first to make sure that that was the case, and then I would consider it as a last ditch effort if nothing else worked. Sovereign Magic, Genova Doctors Data, those are, yeah, labs that you can get advanced stool testing done from. So lately, I've I've seen mostly panels from Genova. Yeah, and you spelled it correctly. Sovereign Magic, Genova, and doctor's data is also spelled correctly. You have to find a doctor that is signed up with these labs. Um, I mean, I'm signed up with them. I don't typically. It's not a big part of my practice. Doing this occasionally, I'll order the tests, but it's kind of a complicated process. It's just not something that we streamlined at this point. Considering adding it or making it more of a part, a bigger part of my practice, but just haven't gotten there yet. But Genova Diagnostics, basically, is one of the labs that's been around for a long time, and that they have a comprehensive stool panel. I don't remember exactly the name of it, but and doctor's data. One of them I think is called GI 360. I think it might be the doctor's data one. Um, and but they both have good studies, and I think they both do SIBO testing as well. Yeah, Dr. Sabine does fecal transplants. That's awesome. Yeah, that's cool. All right, everyone. Thank you so much for sticking around. Even though Dr. Butter didn't show up, hopefully we'll have him on soon, though. And I just want to everyone. I think it's Monday that we have Dr. Brian Ardis, right? So you know, I think a lot of people were kind of upset with me. Why did you, doubt Dr. Ardis? So I'm glad that we were able to get him to come on and talk about, you know, the snake venom theory. Yeah. Yeah, I call these things snake oil. So these are the vaccines, and remdesivir. These are like snake oil treatments, and they may be linked in some way to snake venom. So we will find out from Dr. Ardis, I think, on Monday whether that's the case. All right. Thanks, everyone. All right.